Hello.
Hello,
Hi, ma'am. Good evening.
good evening. So, this is your first session with me. That is Vishal Dua, right? Duha. Am I right? Your
Duhan.
name? Duhan. All right. Okay. Where are you from?
I am from Haryana.
All right. Okay. And what do you do there?
It's my hometown, and by profession, I am a railway employee.
Great. So, why are you suddenly thinking about learning this language?
It's not suddenly. This thought came in my mind multiple times, but right now I have opportunity to learn this language, so I grabbed this.
Opportunity. Very good. So, are you thinking of advancing your career?
No, for make my life better, I am here.
All right. Just to make your life better and to feel better, more confident of yourself. All right.
Yes, for
Okay. Good, good. So, okay. So tell me, like you said, Haryana is your home state.
right, ma'am.
Hmm. So I've heard a little bit about Haryana. It is an agricultural state. Can you tell me a little bit more about the state?
Yes, ma'am. Majorly we grow white and wheat and rice and sugarcane. So three crops are major here. And
Mm-hmm.
apart from these crops, we grow millets and vegetables.
Mm-hmm. Okay. And do you have an agricultural land yourself?
Yes, ma'am, we have.
All right. So because I think everyone over there must be owning or must be farmers. Actual profession is farming.
Right, ma'am, it's a primary profession. Like
Mm,
I am in job, but my father still he's working as a farmer.
yes, most of the people, I think, Punjab and Haryana especially, wheat, I think, comes majorly our wheat comes from Haryana.
Right, ma'am. Very true.
So that way it is a very rich state. Do you agree?
It's
It's a
not.
rich state.
It's in between, not rich and not poor.
Okay. Rich in the sense that it has got all its land is very rich. That's why the yield is more.
Okay. Okay, ma'am.
Agricultural
Land
yield
is
is
fertile here. Okay, ma'am. Land is fertile here.
yes, that's why the agricultural yield makes the place very rich. Not
Okay,
because
but
of the money.
economic condition is very. Some farmers are rich, some are poor. So it's very also here.
Yes, I think it's a mixed bag that way.
Right,
Economically,
ma'am.
a mixed bag. All right. Okay. So why don't we go to your topic for the day? Do you have your notes, please?
Yes, ma'am. I
You
have
must be
one.
having some notes. Okay. Is being sick costing a lot? Okay. Now, being sick. All right. A popular saying in English means that it is wise to take appropriate steps to prevent illness from occurring in the first place rather than trying to treat or cure them after they have already occurred. One of the main reasons for this belief is cost effectiveness. Do you believe in this?
Yes, ma'am.
So, do you think prevention is better than cure?
Yes, ma'am. It's better 100, 1,000 times.
Yes. Why do you think it's better?
Okay. Right now I am not ill, but if I maintain my diet, I will continue my exercise and balanced
Hmm.
diet. So I
Hmm.
will prevent illness from my body. But if I will
Hmm.
get ill, so definitely all things will mix up. It will affect my life, like my physical health, mental health, my working hours, my work. It's
Yes,
affect me deeply. It's affect every person, not only me.
that's right. And so, because of this, you might end up spending a lot of money if you don't take care of yourself. So, in case
Yes,
you
ma'am, very
actually
true.
prevent, yeah, if you prevent the illness, definitely you don't have to pay for the doctor's fees or you don't have to pay for medicine. So that way it is going to be cost effective. Yes. All right.
Yes, ma'am, I agree with you.
Yeah, good. Why do doctors often advise us to eat healthy food and exercise regularly? How can this help us to save money on medical bills? It is a doctor's advice. Always they tell you to eat healthy food.
Okay. Food are resources of many things like
Hmm.
vitamin and carbs, protein, fat. So all are essential for our health.
Yes. So, what is your typical diet like? In case you want to discuss, like what kind of diet do you follow?
Okay, you, ma'am, I come from Haryana, so it's common thing that we like milk-based product like
Yes.
milk, chash, mixed curd, ghee, butter, and cheese. So
Yes.
mostly we like milk-based product.
All right.
And
And of course,
especially in my case, I prefer eating homemade food.
all
Like
right.
maybe it's potato paratha, it's vegetable, rice pudding, halwa, and
Mhm.
puri. I prefer homemade food, ma'am.
Everything but cooked at home.
Yes, ma'am. And in my diet, I take some salad and some fruits. Every day I try to have some fruit.
Good. Very
It's
good.
seasonal.
Very nice. That's a very good strategy to take. I think sugarcane is also available, ganna in your state.
Yes,
Sugarcane.
ma'am. Yes, ma'am.
So seasonal time, I think during the season people drink a lot of sugarcane juice also, which is healthy.
Right, ma'am. It's healthy.
Mm, it's good. All right. So do you think healthcare facilities have become more expensive today than before?
Yes,
So
ma'am. By that time, it's getting expensive day by day. It's
yes.
all thing you can like if 10 years back you had visited in a medical in a hospital for treatment. That times you think in some thousand was enough. Some thousand, 5,000 was enough. But right now, if you visit a doctor, so thousands are not enough. If they will give you shock that you are
Yes.
facing this problem, this is the solution. And
Definitely you'll
ma'am,
get a
for
shock.
I am in job. I am a central government employee. After
Hmm.
that, I am not able to reach a multi-specialty hospital.
Oh
They are
no.
beyond my reach. So how can a middle class person afford them?
That's true, very true. You are right, absolutely. As a middle class person, what can we afford? We can only go to the government hospitals. And do you think the government hospitals give good treatment to people?
Ma'am, okay. Patients ratio is I think in lakhs, and doctors are in only hundreds.
Mm,
We have less
yes,
doctors. Doctors and some doctors do malpractice. They are working in government sector, but apart from these profession, they have their private clinic. They
that's
prefer
right.
to treat clients there, ma'am. It's very
Mm.
common.
Because of I think the pay structure is not really sufficient for them in the hospital. Government hospitals
Maybe
may not be given them. I mean, the amount of work that doctors do actually is quite a huge thing. I mean, they don't have any rest, night and day they do work. So that's why
yes,
maybe they
ma'am.
try to do the
Government should
malpractice.
fulfill government should fulfill the vacancy.
Correct. They should facilitate these doctors. Then only, the kind of corruption that is on will reduce. Unless they are given their dues, they will keep on doing outside. That's why.
Right, ma'am.
And, and the common
But
man
in
does not.
private scenario is different. If you have money in your pocket, so after
Yes.
entering, they will ask you it's for entry, it's for X-ray fees, it's for CT scan. So it's
Mm,
for our. They have their own medical store, and they have condition. You have to purchase medicine from here only.
yes. And do you have insurance, medical insurance
I have common insurance from my service.
through your service? So it is provided by your
Apart
office,
from that, yes, ma'am.
railway.
Apart from my services, I don't have LIC or any banks
Mm.
insurance.
Hmm. So need some insurance. Everybody actually needs to do some health
Everybody
insurance.
needs some.
Yes. So yeah, how can you
Okay,
prevent
ma'am. Do you have
accidents?
insurance? Okay. Do you have insurance or not?
Yes, yes, we have to have insurance because otherwise, how are we going to suffice when we actually get hospitalized or we have some illnesses? We can't do it without insurance. Health insurance is definitely a priority.
Okay. Before some years, Sahara Group was working here, and they took money. They took lots of money from people, and right now it's not working. Have you heard about this?
Yes, I know about the Sahara scheme. I mean, it was a disaster. I mean, previous years, I think people were all right with the investments. They used to give back, but later what happened was, they were not paid back. A lot of money of my own, some of my relatives is, lying there with Sahara India, still there. A lot of money, not just a little money. Maybe it runs in lakhs. So it's a huge loss. They
Yes,
have
ma'am.
lost
I
all the
heard
money.
this news from my relationship. One of my relative told me this scenario. Their whole
Mhm.
family was continuing their investment in their. They had insurance of this company only.
Yes. And it's very sad that people have not been given back their dues, their own hard earned money, and that's what the company took away. And still now, there is no repayment. So we still don't know whether it's going to come back. It's
Right, ma'am.
unsure. Actually, I think people should not invest in private, I think, any bodies like this.
Yes,
Private
ma'am.
bodies are risky. So
Risky.
yes, LIC is all right maybe, but I think these all, Sahara India and things like different nowadays. A lot of other structures have also come up. People should avoid
Right,
doing that.
ma'am.
You don't know whether what is going to happen. So tell me, how can you
Yes.
prevent accidents at home, like falling or cutting yourself?
Okay. For falling, we don't need to use like what I say marble tiles. It's
Uh,
looking good. It's for attractive, but it's not
yes.
good for health.
It may not
If you
be very
slip there,
safe.
so maybe
It is not
you
safe.
might be getting injured.
Yes, they're slippery. Sometimes these tiles are slippery, and if there's water on the tiles, you might just slip and fall, especially elderly people. If you have parents and grandparents, and they might slip and fall.
And ma'am,
So,
it's a very common thing. Every after some months later, we heard this news that this uncle or this aunt get slipped in bathroom and he or she got injured.
hmm, this is quite common because when they become elderly, they can't keep their balance. That also is difficult. So, we don't know. And how can these actions help your family avoid medical expenses? Okay. Falling and cutting themselves, something like this. How can you avoid? You said tiles and all this. And these actions, if you are not putting tiles, bathroom tiles, try to avoid throwing water, spilling water on the
Yes,
floor.
ma'am. Yes, clean water
Yes, we should keep
at the
our,
same time.
surroundings dry also. And the steps
Yes, ma'am. We
also, in
should
case
keep.
yeah, in case you have a staircase, which is not a very easy staircase, elderly people should avoid climbing up and down the stairs. So that can be avoided. So, they could use the ground floor mostly. If you have a two-storied or three-storied house, ground floor is better for the elderly people. So you can prevent that accident.
Yes,
All
ma'am.
right. So why is it
And you
important?
can, okay, ma'am, in home, here are some sharp tools like
Yes.
knife, and many things. So
Hmm.
you should keep these things away from children.
Yes, especially that. You
And
must.
if you are doing some electric work, so that times you need to wear gloves.
Yes, of course. And the switchboards, what about the switchboards? The position of the switchboards.
Okay, I
Sometimes,
noticed in
switch,
some family they have switchboard in very close to floor, so it's not
mm,
good because the
yes,
children don't know what is the. They think that it's a toy, so sometimes
yeah.
they go to electric shock.
They might just put their finger into the socket and hurt
Yes,
themselves.
ma'am.
Yes,
And you have to use a good quality cable and all things
yes,
on
you're right.
that good.
Right, right. So why is it important to wear weather appropriate clothes? How does this save money on medicine? So weather appropriate clothes. What do you mean by that?
Okay. Ma'am, it's good for your health.
No, not for your health. I mean weather appropriate.
Okay, I
Something which
understand.
will,
I got
yes,
it, ma'am. In
yeah,
summer, you have to clothes that
yes.
you should wear t-shirt, normal clothes. You can't
Mm,
wear a thick jacket in
yes,
summer.
correct,
So we
correct.
should wear weather appropriate clothes. It's to keep
Yes.
ourselves fit, healthy, not fit. It prevent illness. Like in winter, if you are wearing only a t-shirt, so definitely you will get a cold. And
Yes.
then it's showing you normal. Like if you are in winter, you are wearing normal summer's clothes, so it's not showing good. Your
That's right.
colleague or your family members, you are looking different. So it's not a thing. It's not a good achievement.
It's not an
Eh,
achievement in the sense. It is like summer. You have to wear light cotton clothes just to avoid the heat of the sun, and in winter you need to wear warm clothes so that you can save yourself from the biting cold. So that way you
Right,
can
ma'am.
avoid diseases. You can avoid the cold. Cold that time you might get cold and cough. In summer also, if you sweat a lot and you're wearing thick clothes, what happens? You get heat stroke. Heat
Yes,
stroke
ma'am.
is common. Yes. And in rainy
Eh,
season, if you don't wear, you don't take an umbrella and walk, that time you might get wet. So again, it
right.
will give way to what? Sneezing, sardi, khasi, all these things will come up. You have seen that
Very common.
a few years back we were down with COVID-19. It was a horrible disease that time, and everyone
Right, ma'am.
suffered. So we should avoid the conditions, right?
Yes, ma'am.
Okay. Yeah. So, what is the importance of washing your hands before eating and using the bathroom? What safety precautions did you take during COVID 19?
Okay. You asked me that why is it important? COVID have learned this thing to everyone that
Yes.
wash your hands. And
Mm,
here are some germs and bacteria we can't see with our eyes. So, but
mm,
they are here, and
mm,
our hand touch the our door, and sometimes we drive, we go outside. So it's
mm,
dirty, it's full of dust. It's not showing that it's full, but we have some
mm,
microbacteria. So you should clean for your to prevent illness, and
mm,
it's a good manner, it's adequate. If you wash your hands, so your children also they will start washing hands. It's
mm.
good for hygiene.
Hmm, hmm. Yes, we should all maintain hygiene. So that is important. And of course, you're right about your children learning from you. So that way, the children
Yes,
also understand the importance of hygiene and you can avoid many diseases because of that. All the germs and bacteria, like you said. Okay. So you don't say the sentence COVID 19 has not learned us. We have learned from COVID vaccine. COVID 19, we have learned from that. Okay.
okay.
All right. How does investing money and effort in installing safety sensors and seat belts in car help you to save on medical expense? So do you think safety mechanisms, seat belts are important while driving?
Yes, ma'am, it's utmost. If you
Mm,
don't wear your seat belt, so definitely if anything, say any object come on the right road,
mm,
so if you take emergency brake, so you can't control yourself and you will get injured. It's
mm,
common thing. But if you wear the seat belt, so you can prevent this thing, prevent the
mm.
major accident.
Correct. And do you own a bike?
Yes, ma'am.
Hmm. So you must be wearing a helmet.
In my village, I don't wear a helmet. It's showing strange. But whenever I go outside, I wear helmet in city or
Okay,
in
so
another
you
village.
to actually wear a helmet always. It's important. to avoid any kind of
Ma'am, can you repeat
fractures
your
or.
line? I can't hear you properly.
Okay, I said that it is absolutely important for people to wear helmet while driving a motorbike.
Yes, ma'am. I agree with you.
Hmm. Yes. So how do you think people can prepare for financial cost of being sick? Say you're sick, your family member is sick, so and you don't have enough finances, how will you be prepared?
Okay. Our health, taking care of our health, it's in our hand. So we should take care of our health. Eating healthy food is must, and simultaneously stay away from bad food. Like here are some things you can't mix both things.
Mhm. I mean, stay
Like
away from
some
junk
foods.
food, junk food, junk
Yes, ma'am, you can stay
fried.
away from junk food. But in foods, here are some foods you they are contradictory. You can't eat together.
Oh
Like
yes.
milk
Ah.
and curd, you can't take both. So,
Mhm.
and here are many things like this. And ma'am, another things is physical activity. If
Ah.
doesn't matter if you are doing yoga and you
Mm.
are playing sports or you are doing any physical activity. So it is very good investment. It can save you a lot of money. If and ma'am, main thing, water is free of cost. It's precious also, but we neglect these things and we don't take proper water.
That's right. We don't drink enough
It's common
water.
thing, ma'am. Yes,
Yeah,
we
it's
don't
very
drink
common.
enough water.
Yeah, you're absolutely right. Okay, can you do the reading of this paragraph? There is one paragraph given. Can you read the
Yes,
paragraph,
ma'am.
please? Yeah, please.
Yes, yes. Why not? In the face of rising costs, medication and healthcare are becoming increasingly out of reach for those who need them most. Addressing the rising cost of prescription drugs is a top priority for our safety. Oh, sorry, society. People encounter tribulations every day because the drug they need cost an arm and a leg, causing them to skill dosage, settle for an alternative that works poorly. Mr. Smith, a patient with diabetes and cardiac condition, mentioned that the medicines he needs to prevent heart attacks cost for $450 per month. He discussed the stress he felt from month to month, never knowing how much he would have to sell out.
All right. So, did you understand the paragraph? What they're talking about? Rising costs of medication and healthcare.
Yes, ma'am, I can understand.
Yeah, there are these few highlighted, idioms they have given out of reach, which means something that cannot be accessed. All right. So
Yes,
what? Medical costs, sometimes it becomes out of reach. Like you said, in private hospitals especially, it is out of reach
right,
of
ma'am.
common man. Yes. Tribulations meaning difficulties. So
Difficulties,
we face many tribulations every day, right? Cost an arm and
right,
a
ma'am.
leg meaning very expensive. Yes.
Very
Sometimes
expensive.
medical expenses can cost an arm and a leg. Hmm? Alternative meaning
Right.
other option, and shell out,
Other
you
option.
spend a significant amount of money. So somebody will say that please, he does not want to shell out any money. He's such a miserly person. That means he does not want to give any money, right? Cardiac, cardiac meaning something related to
Heart related.
heart related disease.
Heart.
Yes.
Yes.
Yeah, okay. So that brings us to the end of this session. And yes, you are speaking well. Only thing I will tell you to try and read loudly because you need to correct pronunciation. Okay, your pronunciation is a bit heavy on the Haryanvi accent. So that can be
Right,
corrected
ma'am.
only by doing reading, loud reading, which you can also do at home. Anything, newspaper, any
Definitely,
text,
ma'am.
book, or anything, any article from your Google also will do. just read loudly. Okay. So that is
Definitely,
one
ma'am. I will.
suggestion I can give you. All right. Okay. Thank you for coming on the platform. We'll meet again. Okay.
Thank, thank you so much, ma'am. Nice to talk to you.
Same here. Good night.
Good night, ma'am.